Hello, my name is Mike Bassett, reporting for the RSNA Daily Bulletin. I'm here at RSNA 2019 with Dr. David Schuster to discuss his experience with a patient-centered care model in the nuclear medicine department. Dr. Schuster, you described the current model of care at Emory as a nuclear medicine therapy care coordination service. Will you briefly summarize how that evolved and what it looks like today?
Well, Mike, it originally started with our intent to ensure that patients were better prepared for their therapies, and this would also improve our practice efficiency. But over the years, as we developed better patient-physician relationships, demonstrated the value of our consults, and also added on other elements such as a dedicated nuke med nurse navigator, it became much more and transformed our practice.
What benefits were realized when nuclear physicians started spending more time consulting with patients?
Well, we found that the patients were much better prepared for their therapy, and this streamlined everything that occurred on the day of therapy. The other advantage was to our own practice self esteem, you may say, and this really energized our practice as well.
And what barriers did your team encounter along the way?
Well, originally, perhaps from some of the old guard of referring physicians, they just couldn't understand the value of what we were doing. Our response was to be collegial but firm that this was going to happen. And even some of our biggest naysayers eventually became some big supporters as well. The other part of this puzzle was, I wouldn't call it pushback, but a little head scratching from our hospital leadership. Our radiology leadership was definitely for this, but hospital leadership as well as coding, billing, and compliance, they just weren't used to us doing something like this. So we met with them, explained our goals, and after we did that, they were in fact wondering why we hadn't done this earlier and why everyone wasn't doing this. And so they've been very helpful with various suggestions of what to do over time and how to modify our plans. So I would say a little pushback, a little head scratching, but now it's been accepted.
And what tips do you have for radiologists who are interested in developing a more patient-centered model in their own institutions?
I would say first, ensure that within your own practice, everyone's on the same page. You don't want to have different physicians going off doing things differently depending on their idea of a consult. So operating from one playbook or a template or however you want to do it is important. I would say the second thing is to marshal your stakeholders, whether it be referring physicians, your department leadership, hospital leadership, coding, billing, and compliance, etc., and explain what you're doing. And they may actually have some very good advice that may modify your original plan somewhat. But in the end, I would not wait to ask for permission. I would, within the bounds of compliance and regulation, start acting and operating like full members of the healthcare team. And I would advocate for your central role as physicians and practitioners who are expert in this area, and above all, advocate for the best patient care.
Thank you, Dr. Schuster. This has been Mike Bassett reporting for the RSNA Daily Bulletin. You can find more RSNA 2019 news at meeting.rsna.org/dailybulletin. Follow us all year at rsna.org/news.